Hi, I'm Dr. Betul Hatipoglu. I'm a professor of medicine at Case Western Reserve University and a systems lead for subspecialty medicine at the University Hospitals at Cleveland Medical Center. I am also currently the director for diabetes and metabolic care and a vice chair of internal medicine.
That's awesome. Thank you. And I guess we're here today to talk a little bit about Scaled Insights technology and the challenges that you're having with patients with type 2 diabetes and GLP-1s. What do you think the impact of Scaled Insights behavioral AI would have for you and other clinicians, not only in your practice, but maybe even just nationwide or maybe worldwide, in treating patients with type 2 diabetes?
I will say I am extremely excited to see that there is some movement in the area that is most needed in medicine, which is understanding the behavior and human types that can impact the treatment success, right? We are missing the biggest elephant in the room, which is human behavior in the success of treatment of chronic disease. This is not about just diabetes. This is the entire part of chronic disease that the world of healthcare is dealing with. So I am looking forward to seeing success, implementing as much as possible your program to really help us tailor better, individualize better the treatments that we choose that we know will work scientifically. However, how are you going to make it successful when it comes to behavior and patient compliance and patients buy into it? And that's what I'm looking for.
Yeah, and I think that's one of the things that we like to talk about a lot. And you say patients buying in, and we also talk about it on the side of helping doctors sell it in, because the patient has to buy it. It has to be sold to them correctly. And I think
totally.
that the modern problem, and maybe I could just ask you about that. Like, I always describe it as that the problem with modern medicine is you've got too few doctors seeing too many patients for too little amount of time.
You got it. You got the killer, if you want to see it that way. That is the virus that is killing the medicine today. Mm-hmm. That needs to be treated, that needs to be recognized. More and more healthcare providers asked to spend less and less time with the human being that they are treating, and they are not trained necessarily how to really address and as you said, sell what the patient needs for their own health and benefits. So the whole healthcare system, at least in our country today, is failing, and in all layers, in the practitioner layers, which means they are burned out, they don't enjoy their job as much, less and less, fewer and fewer people are going into the parts of medicine that needs the most compassion time, but is gets the least amount of time to spend with the patients, and the patients suffers as a result of that lack of enough time, which prevents enough teaching, compassion, and care for both sides.
Yeah, and overall, the Scaled Insights approach is all about making that time very high quality by giving the doctor the insights into what makes that patient tick, and therefore how to sell that solution.
I can't wait.
Thank you very much for this. This has been fantastic.
Thank you.